policy in that way in a world where central government's hand on the tiller, central government's control over what goes on in systems is going to be drastically reduced, because that's seen as financially and probably intellectually a good idea. Plus these departments that we're actually using to organise these trials and to sort of set up these policy experiments are also themselves being not just downsized but also kind of constantly reorganised, rebadged and so on. Because there's a lot of emphasis, and I hear it and see it here as well in the time I've been here, about the importance of local solutions to local problems, empowering local people, professionals, whatever, to solve the problem and to implement the solution. And again, in that world, and I'm not making any value judgment on its superiority or inferiority to the sort of the world of the sort of nationally driven randomised controlled trial. On the one hand, yes, I mean that could lead to more experiments. There could be a lot of experiments, both sort of formal and natural. But also at the same time you could get a lot of very, very unhelpful variation that's it's very hard to make sense of or to handle within any sort of data collection process. You could get so much variation in what it is you're trying to achieve that the sort of signal to noise ratio gets completely out of kilter. Or you get evaluations at a so small scale that, again, it's very, very difficult to generalise the knowledge. So it's not, again, it doesn't necessarily move us clearly, certainly in support of the sorts of rationalist proposals that I've outlined. And we had an example of that recently in my research unit, where we were asked to advise, not to do an evaluation, but to advise on the sort of basic design and approach, and help the group that was eventually going to win the tender to do this national study of something called drug recovery wings. Now, we were asked to do some preparatory work around trying to understand how they were being put in place and what the issues were, what would be a good set of outcome variables, what kind of structure for an economic analysis should there be around this idea. The basic idea, as it was told to us, these are parts of prisons where people are segregated, usually about a year, 18 months before discharge, and put into a drug-free environment. And then the rest of the program they receive at the individual level, the sort of individual interventions, are probably no different than other things that are available in the prison. It's just that they're all provided in a kind of joined-up way. So that was what we were told. So we went away to look at this thing. So we're being asked to advise on an approach to evaluation after the pilots had already been identified. And we had obviously no ability to influence how they were going to evolve. But nonetheless, we tried to find out what was going on, and I guess our key preparatory task was to identify what was going to be distinctive about these drug recovery wings, naively with a view that we were thinking, well, what can we compare them with? Or can we compare them with each other? So in what sense do they differentiate? Given that the individual interventions within the drug recovery wings were things that were commonly available in the system. And our initial conclusion was indeed that, yes, it's the environment, stupid. That's what this is about. The mechanism or the underlying ideology or the view, thing we need to look at, it's about place. And it's about, the other thing related to that is all services in one place. So a sort of supermarket. You bring all the stuff to the client or the prisoner in one place, and you keep the drugs somewhere else. And possibly, maybe, there'll be some dose-response thing you can look at. As soon as we got to that point and we went further into it, we then looked at what the prisons were actually doing, and we discovered that none of those three things obtained. There were prisons where the DRWs had less resources than the rest of the prison. There were prisons where non-participant prisons were present on the drug recovery wing, and there were prisons where the drug recovery wing prisoners were using facilities outside the drug recovery wing. And when we said, this is really not very helpful, we understand local variation, that's really good. In fact, comparison is the essence of social science. And there's some quite interesting comparisons there. And here's 3 dimensions on which we could vary what these DRWs are. we were told, "Oh, I'm terribly sorry, we have no control. It's all about local solutions to local problems. We want to empower the prisons to make a step change in their drug recovery programs pre-discharge." Anyway, we did provide some advice, and we were very glad that we weren't going to be doing the evaluation. Although there were other groups who were very keen to tender because money was at stake. And I just wonder what we'll learn from this evaluation. So actually one of the slides I skipped over was about, in a sense, the suppliers are quite keen to provide this stuff. But I'm wondering, in this kind of environment, whether the suppliers of evaluation need a little bit more influence before they should be invited in to have the discussion. Because we were not only very late in the process, although very early by comparison with how it would have been in the recent past, in terms of actually getting involved in providing advice, we just didn't have any decision rights. We didn't really have a voice in this process. And there's a question really about the sort of obvious power imbalance there. I'm not being precious, I'm not assuming that researchers should run the world, but if you're going to spend money on them and involve them in this way, there's a question about, well, what are you going to give them an entree to do? What are they actually going to be at the table? But of course they're not public servants, they're not there to advise, they're not ministers. What authority do they have if you want this kind of engagement? So in a sense this is a very enlightened approach to have this discussion, and we spent about 9 months tracking these things and trying to figure out what they were doing. So my conclusions and observations. As I said, I've been sort of flip-flopping between feeling rather depressed about the naive rationalism of the Cabinet Office Behavioural Insights team, and on the other, sort of retreating into a kind of postmodernist sort of obscure world where actually, well, none of this really matters. It's all about it's all about inscribing, it's all about the text, it's all about the rhetoric of policy. But I'm back into we must have ways of making this better, but I think we probably just need to not put ourselves in situations where we put forward proposals that are patently unrelated to the kind of world in which we're trying to influence. So it seems to me that we're going through another phase where the role of evaluation in public policy is being rediscovered. It's rediscovered about every 5 to 10 years in the two countries that I know most about. As an evaluator, I can't be against the call for more and better evaluation, and my university certainly would be very upset if I turned away huge amounts of work, and that's a real problem, as I mentioned. Many of the recent ideas and proposals are very worthy. Some may have some positive effect, but as I said, there are many contrary pressures. But some of them seem slightly naive, although well-meaning. But on the positive side, I can see that there are certain kinds of policy issues and policy processes which are much more amenable to the use of evaluation, to scientific advice, and we should push from those bridgeheads out into wider fields, recognising that, yes, of course, there are going to be other areas where the ability to shift the way in which policy making is undertaken is going to be extremely limited, and sometimes for very good reasons, that essentially that this is what democratic governments can do, and that it's not our job to kind of second-guess politicians. I think the sort of naive criticism that says that the problem with policymakers is that they just aren't interested in evidence is clearly wrong. They do seek to be informed, they're not irrational, but the dynamics of the sort of science that a number of the clinical trialists who've got interested in social policy are, the sort of how and why questions that they want to ask, and the policy dynamics of deciding and decision-making are very, very different, and we just have to, up to a point, accept that. So there'll always be limits, it seems to me, on the use of evaluative evidence in policy making, and that what we should, I think, be aiming to do is, rather than on the one hand give up, or on the other hand try and impose a kind of straitjacket which is grossly naive, we should be trying to move towards or strive towards something that Ian Sanderson calls intelligent policy making, which is policy making that understands something about the complexity of the environment we're operating in, understands something about what rigorous pragmatic approaches really are like, and we don't, in a sense, throw out the baby with the bathwater, because I think the problem at the moment is we seem to either, on the one hand, we seem to have a recurrent desire for better versions of the same kind of experimental approaches that in the past we've shown do not sit easily with much of public policy. So there's a real risk that we don't put anything in their place. And I was very, very struck. Well, I've been sitting at Vic for the last month, and I've done a bit of reading, which is very unusual for me. And thinking about, well, what is different about policy making and experimentation? Because there is this quite big literature that says policy making is an experimental activity. So what do we mean by experimentation in this context? When you hear it from the UK Cabinet Office, it's a very different version from when you hear it from the political scientists. Is there any way we can bring these two notions together? And I was very struck by two diagrams in a paper from the Institute for Policy Studies over at Victoria, a paper called Experimentation and Learning in Policy Implementation, Implications for Public Management. And what the authors there are trying to grapple with is really the same issue. They don't start from the evaluation bit, but they start from the question of what's good policy implementation in the modern world. And they say that the sort of model is a lot of us are continue to repeat, really, and it's true in that Cabinet Office paper on randomised controlled trials, is a kind of world in which a lot of the policy making activity is fairly controllable within the sort of policy bureaucracy. So in this diagram, this is just their stylized picture of what's in the mental mind map, perhaps, of when we're thinking about, let's focus more on outcomes, let's set targets, let's have more intrinsic policy evaluation, is that within government agencies, a lot of the policy process can be contained and managed. We can observe the problem, identify it, gather information, develop options, identify possible options, implement them, follow up, and then as they're implemented, do the evaluation and so on. So it's a kind of conventional stages model of the policy process. And I think that still lies behind a lot of what is well-meaning, worthy, but potentially really rather doomed analysis in relation to evaluation. So they posit and claim that this is a closer version of what typically we're trying to do in policy making in the contemporary world. A rather different model where action and feedback, and then the iteration of action and feedback, is a kind of continuous flow of process between these, what goes on within government agencies and what goes on, as they put it, in the real world or outside. And that there is constant experimentation and a movement between these different worlds. So basically what policymakers are doing is they're not at one point in time testing a hypothesis. They're not comparing drug recovery wings with something else, nor are they necessarily doing what the Brits did with their drug recovery wings, but they are sensibly saying, right, we've got these three elements that we think might be distinctive. So we're going to be continuously testing and refining those models of drug recovery and learning by doing, and then taking every opportunity we can to put in place rigorous comparative studies and possibly even randomised controlled trials, while recognising, though, that we don't have necessarily the process entirely going on within the government system. So you'll see here that perhaps what they call the hypothesis is generated within an agency. This may be the policy imperative, this may be the bright idea, but actually a lot of the action takes place outside, and that's really where the learning needs to take place in collaboration with all the interests that are pertinent to the policy, the prison governors, the prisoners themselves, their relatives, the NGOs that support prisoners' welfare, the drug organisations, and so on. So a rather different model. So I take from that if you bear that version of policy reality in place, that still leaves an awful lot of room for appropriate policy learning. It's just that what we're recognising is that policy making involves a different kind of experimentation from the sort of model that the proponents of RCTs put forward. It's a process of more and less formal learning that's continuous. And so the trick is finding opportunities in ways in which those repeated learning experiences can be adapted for research, rather than saying, well, what we must do is at one point in time we must decide once and for all, for example, whether class size under 30 pupils or over 30 pupils is better than not. At that point, I think I should stop.